know when I'll start. Well, hello everyone. My name is Keith Park. I'm the director for the Korea Health Policy Project, Harvard Medical School. Welcome. Good morning, good afternoon, good evening. Today we'll have a webinar titled "What Import Data Reveals About North Korea's Health Priorities." Um, this is the third webinar in a series of four, looking at overall the health of North Korea and the geopolitical factors that influence health. And then today we'll have a deeper dive into what we think are North Korea's health priorities based on some import-export data from China. But I just wanted to let everybody know that there is another webinar about a month from now on April 22nd, where we'll actually do a further deep dive into what does re-engagement on North Korea on health, what does that look like post-pandemic, post-geopolitical shifts that's occurring really right now. And that will be an interesting and the last part of our webinar series. I just want to thank our partners in this project, NCNK, they're here, Keith is here, Marissa and Seth, thank you. Council of Korean Americans, 38 North, and I'll just in a minute introduce Jenny Town, U.S. Institute of Peace, and then Children of Korea. This webinar is moderated by none other than Jenny Town, who is a dear friend of mine. She is the senior fellow at the Stimson Center in Washington, D.C., but she's also the founder and the director of 38 North. Almost every one of the papers that we've presented from the Korea Health Policy Project in this webinar series have been published at 38 North. We know that policymakers read it. We also know the North Koreans read it. I can tell you for a fact that when I was in Pyongyang a few years back, the North Korean officials had a printout of the 38 North article, and then they were referring to it. So we know they read it. I'm going to turn it over to Jenny now to start moderating this session. So go ahead, Jenny.
Thanks, Key. It's always good to see you and to see your crew here. We're always really entertained and amused when we hear stories from the North Koreans about articles they read in 38 North. And I've certainly been in meetings as well where in the track two circles where someone pulls out a laptop and says, well, I was just reading this article on 38 North about sanctions. And don't you think that hurts the people and stuff? So it has been an incredible vehicle mechanism to convey information about North Korean policy and policy about both political and technical analysis on what's going on in North Korea. So if you don't know it, please check it out. But we're really happy to have this discussion today talking about North Korean health priorities. What have we seen? What can we tell from the import data itself about what North Korea is doing? What kinds of equipment and medicines that they're looking for to try and give us some sense of how they might be thinking about the health situation in North Korea. We have a pre-recorded message first from Uri Lee, who's our main presenter. She's a rising third-year medical student at Georgetown University with a strong interest in infectious disease and global health advocacy. She has a BS from University of Southern California in human biology with a major in international policy and management. And has been doing a lot of research looking at the intersections of healthcare policy and humanitarian work. And then with us as a discussant today is Asa Sandberg. She has a background within the humanitarian and development aid sector. She has, during the last 7 years, been closely engaged in DPRK-related humanitarian issues in partnership with the DPRK Red Cross and humanitarian diplomacy for North Korea. She holds a wide network of humanitarian and research colleagues globally, primarily linked to Korean Peninsula matters and sanctions-related issues. And until 2024, she held the position of IFRC head of country delegation for the DPRK. with duty station in Pyongyang. She's temporarily based in Malaysia, and at present, she's senior advisor on the DBRK to the public affairs at the Swedish Red Cross. So a lot of knowledge here to tap into today on this great issue. And we are going to start first with Uri's presentation. Is that correct?
That's correct. My name is Hije Lee. Actually, Uri did a good job, and then she spent a lot of time to make a presentation. But unfortunately, her schedule didn't allow to attend, on live this morning. So she recorded the presentation. So I'm about to run it. But before playing the video, I'd like to provide some context about our team's research. In her upcoming presentation, we will summarize two articles that our team recently published. The first one was published on March 2024, pretty recent, and the second one was on January 2022, which is a little earlier than the first one. She will present in this order because the second one has the more to talk about. So I'm going to play the video now.
Hi everyone, thank you so much for being here. My name is Jess Lee and I'm a third year medical student at Georgetown. Today during this presentation, I'll be talking about medical imports in North Korea. So today I'll discuss the recent surge in North Korea's medical imports and what this trend reveals about potential opportunities for engagement. This presentation will provide an overview of two key papers published by the KHPP team. First one being how a surge in medical imports reveals new opportunities to engage with North Korea, and the second one being why North Korea is buying more insulin than ever. I will begin by summarizing the left paper first, focusing on overall medical import trends, particularly the rise in pharmaceutical and medical equipment imports. Then I'll transition to the second paper, analyzing the dramatic increase in insulin imports, what it suggests about North Korea's healthcare system, and how it may shape future international cooperation. North Korea has historically maintained a closed-off approach to external assistance, particularly in healthcare sector. However, recent data on its medical imports, particularly from China, indicate a shift that may open new doors for international collaborations. So as you can see in this graph, the bar represents the total spending in US dollars on medication, while this line of graph shows you the percentage spending of total import on medications. Since 2017, North Korea has significantly increased its imports of pharmaceuticals and medical imports equipments from China. And even during COVID, as you can see, when North Korea's overall imports decreased, as you can see from these bars, its healthcare-related imports actually grew. In 2021, medical imports as a percentage of total trade with China increased sevenfold from 2015 levels, and the country has imported substantial amounts of ventilators, insulin, and respiratory therapy equipment, suggesting a growing investment in critical care infrastructure. So what does this surge in medical imports mean? There are several factors that I would like to point out. So the first one is increasing medical need. North Korea's healthcare system has long struggled with endemic disease like tuberculosis, high smoking rate, and limited access to modern medicine. This increased importation of respiratory equipment aligns with efforts to address these long-standing public health concerns. Second is about post-pandemic rebuilding. The pandemic severely depleted North Korea's medical stockpiles, and as borders reopen, there is likely a push to replenish supplies and prepare for future outbreaks. Third is about government policy shift. So North Korea's leadership may be prioritizing public health investments, recognizing the strategic importance of a healthier population. The recent election of North Korea to the WHO Executive Board suggests a willingness to engage more with global health institutions. Last one is about sanctions and workarounds. With heavy sanctions limiting direct foreign aid, North Korea has opted to import medical supplies directly rather than rely on external humanitarian assistance. Having established that North Korea has significantly increased its medical imports, particularly in pharmaceuticals and critical care equipment, I will now shift focus to one specific import that has seen an increased surge, which is insulin. This trend raised important questions about the country's evolving healthcare priorities and the accessibility of diabetes treatments. To explore this further, I'll first provide an overview of diabetes and its management, then analyze the data behind North Korea's insulin imports, and finally discuss the broader implications for the country's healthcare system and opportunities for international collaboration. So, as you guys probably have heard of diabetes before, diabetes is a chronic metabolic disease characterized by high blood sugar levels. It occurs when the body either does not produce enough insulin at all or cannot effectively use the insulin it produces. So there are two main types: type 1 diabetes, which is basically an autoimmune disease where the body destroys insulin producing cells. It requires lifelong insulin injections for survival, and it's usually tend to be more common in younger individuals, though it's not all that case. For type 2 diabetes, it develops more gradually, often due to lifestyle factors and genetics, and it can be managed with oral medications, but some do require insulin therapy. It accounts for the majority of diabetes cases worldwide. So the reason why diabetes is such a concern is because if left untreated, diabetes can lead to serious complications such as kidney failure, blindness, limb amputation, heart disease, and stroke. Diabetes is becoming a significant issue in North Korea as non-communicable disease known as NCDs increase across developing nations. The WHO reported that NCDs account for 84% of deaths in North Korea, and the government has made efforts to combat NCDs, prioritizing prevention through national plans and policies, including the WHO's tobacco control framework. With an estimate of 1 to 5 million people having diabetes in North Korea, diabetes remain a major challenge. To talk briefly about North Korea's healthcare system, North Korea has a nationalized healthcare system where the government owns and operates most facilities. So it provides healthcare to citizens at a little or no cost. The state ensures healthcare availability for everyone, though the quality can vary. Preventive care is a major focus, with an emphasis on immunizations and health screenings to prevent disease outbreak. Though healthcare is technically free, the system faces challenges, particularly in rural areas, due to shortages of medical supplies, trained professionals, and modern technologies. Access to specialized treatments is also limited, with more advanced care often concentrated in the capital, known as Pyongyang City, and sometimes reserved for high-ranking officials. Globally, access to insulin is a major challenge, especially in low-resource settings and areas like rural North Korea. Without insulin, there is a high risk of death and complications, as I mentioned. In addition, insulin must be stored properly in cold chain logistics, so we were really curious how North Korea would be using and controlling and distributing insulin. In order to answer that question, first we analyzed insulin imports into North Korea from China as a surrogate estimator for diabetes treatment coverage. We used publicly available monthly Chinese export data to North Korea dating back to 2017. We found that pre-pandemic 6-month average total insulin imports in US dollar was around $54,000. According to summarized custom data, the major drop in trade due to COVID-19 virus border closures occurred in February of 2020, and the 6-month average insulin imports during the pandemic border closure, which was around February 2020 to June 2021, was only $7,733. This means that insulin imports dropped by 85.8%. However, for the first time in a year, there was a massive import of insulin in July 2021, totaling $409,000, and then again in November 2021, totaling $605,000, which was actually very interesting. So in order to do more calculations and really see what this data means, First, we calculated how many people with diabetes are dependent on insulin in North Korea. Like I said, for type 1 diabetes, everyone basically needs insulin. And there were no specific studies that reported the number of patients in North Korea with type 1 diabetes. So we calculated the number based on type 1 diabetes prevalence in South Korea because type 1 diabetes is largely influenced by genetics. So the prevalence in South Korea is around 0.017 to 0.021%, and using the middle value of 0.019% for North Korea's population of 25 million, we estimated that approximately 4,750 people will have type 1 diabetes in North Korea. For type 2 diabetes, there was actually a study reporting that an estimated 822,711 people live with type 2 diabetes in North Korea. Previous studies suggest that around 11.2% of individuals with type 2 diabetes in Asia are insulin dependent. So applying this rate to North Korea's population with type 2 diabetes, we estimated that around 92,144 people will have insulin-dependent type 2 diabetes in North Korea. To measure how these imports in dollars translate into how many people it can actually support, we did some calculations. So first of all, for type 1 diabetes, we estimate that each person requires about 1 unit of insulin per kilogram of body weight per day. So basically using a conservative estimate of 50 kilogram as an estimate average weight for a type 1 diabetes patient, this would require 50 units of insulin per day, or about 9 vials per person every 6 months. So this turns out that before the pandemic closure, North Korea's insulin imports could support approximately 3,672 type 1 diabetes for 6 months. During the border closure, the number of diabetes supported dropped significantly to just 694 patients. However, after the border reopened or after post-border closure in 2021, the insulin increased to supporting 31,178 type 1 diabetes every 6 months. So now we also looked into how many vials a person with type 2 diabetes uses per year. So in Asia, it's estimated that 577 million insulin vials are needed per year by people with insulin-dependent type 2 diabetes. Dividing this by the number of people with diabetes, we found that each person uses around 15.34 vials per year, or 7.67 vials per every 6 months. Chinese custom data shows that insulin imports in kilograms, so we estimate that each insulin vial weighs around 40 grams. That means pre-pandemic, North Korea imported an average of 33,050 vials every 6 months. However, during border closure, this dropped to just 6,250 vials, and post-closure in 2021, North Korea imported large shipments totaling approximately 280,600 vials. This means that before pandemic, this imports could support around 4,300 people. During the border closure, it could support 815 people, and post-closure, it could support around 36,000 people. So if we add up both type 1 and type 2 diabetes insulin need, North Korea's overall insulin needs approximate 749,000 vials every 6 months. For type 2 diabetes, this equals 706,000 vials, and for type 1 diabetes, it was 42,000 vials. So basically, before the pandemic closure, as you can see in this picture, North Korea only met around 4.4% of this need. During the closure, it supported just 0.8% of the requirement. However, since July of 2021, with the post-closure, insulin imports have increased significantly, now meeting 37.4% of the total need. This shows a substantial improvement in diabetes treatment coverage, and we thought that this was very interesting change, as 4.4% of pre-pandemic to 37.4% of post-closure is a huge jump. So all the data that I just showed you was what's covered in the paper that I talked about, which was only until 2021. However, for this presentation, we actually analyzed a few more data that was after 2021. So very interestingly, like I said, in 2021, there was a huge jump, which was around $1 million in a year. However, right after that, it dropped around 80.84% to just $194. And then after 6 months, it jumped up again, up to $741,000. And after that, it actually dropped significantly, as you can see in this bar, just as pre-pandemic. We're not really sure what this means, but we do have a few discussion points that we would like to point out. So, as you know, Pyongyang is the capital city of North Korea, and it accounts for at least 10% of North Korea's total insulin needs based on its population size. Surge in insulin imports could cover nearly 4 times the amount needed for all insulin-dependent diabetes in the Pyongyang city. And we think that this suggests North Korea might be treating diabetes beyond just the elite who are concentrated in Pyongyang city, which is a very different perspective than what we have thought of, as we always thought medications are not very accessible in rural areas. The main reason why we thought this was a case is because insulin has a short shelf life, around 28 days unrefrigerated and about a year when refrigerated. While North Korea's cold chain capabilities could support insulin storage, the details are not very clear, so we thought that the large shipments likely reflect the Ministry of Public Health prioritizing diabetes treatment rather than just stockpiling. There are other general discussion points I would like to discuss. So first, domestic production of insulin by Pyeongsu Pharma is possible but limited by sanctions, and diabetes treatment require more than just insulin, especially for type 2 diabetes, as I mentioned. Despite these challenges, the global community must work together to address the barriers to insulin supply, as noted by the WHO, including logistical and regulatory hurdles. In conclusion, diabetes in North Korea is expected to rise, with an estimated of 944,000 people living with type 2 diabetes by 2030. Recently, the country has prioritized diabetes treatment, evident from a surge in insulin imports since July of 2021. The value of these imports was 11 times higher than any pre-pandemic 6-month period. As North Korea reopens its borders, analyzing this insulin could provide valuable insights into the country's investment in healthcare and its shifting health priorities. However, ensuring adequate insulin coverage in North Korea faces several challenges, including sanctions that hinder the production of insulin and medications, limited fundings for non-communicable disease from organizations like WHO, and pricing and access issues in low and middle income countries. However, WHO reports suggest pathways for improving insulin access. This presents an opportunity for the international community to collaborate with North Korea to address the growing needs of people living with diabetes and non-communicable diseases. Thank you.
So a great presentation by Uri, and of course, we wish she was here so we could ask her some questions about it. But before we get to that, Osa, I did want to turn to you and get your thoughts on the presentation and on the broader kind of health picture that we see in North Korea these days.
Thank you, Jenny. Yeah, so do you want me to give my presentation now and share my screen?
Yes, yes.
Yes, so let me see if I can choose the right one. Can you see it?
Yes, we can.
Perfect. Yeah, so I will give a little bit of a different presentation. It's not as filled with data, perhaps, but it gives more of a broader understanding of the Red Cross engagements in DPRK on especially health-related issues, but also other work of the Red Cross and a bit about the history of of the DPRK Red Cross and the Swedish Red Cross. So my name is Åsa, as was mentioned. I'm working with the Swedish Red Cross at the moment. I used to be the IFRC head of delegation for DPRK until last year, but as you already said, I could not enter DPRK during that period of that assignment, but I visited the country between 2017 and 2019. I started working with the DPRK Red Cross in 2017. So that's where I'm coming from. And so what we know is that DPRK Red Cross has 220 staff and they have 209 branches throughout the city and about the country, and about 350,000 volunteers engaged with the Red Cross. And the IFRC, the International Federation of Red Cross Red Crescent Societies, is a membership organization consisting of 191 national societies, and they are supported and coordinated and represented by the IFRC Secretariat, which has a center in Geneva, but also then country delegations like the one in DPRK. And IFRC coordinates the support to national societies depending on their request for international support under certain circumstances, primarily related to natural disasters or also protracted need situations. So the model is pretty similar to the UN humanitarian system as well. And in the 1990s and the crisis that they were faced with, the DPRK Red Cross then called for international support, and the IFRC then established itself to coordinate a response. And the National Society has then been running programs ever since in different areas, and the last 10 to 15 years operated more holistic programs on resilience with more of a long-term approach to strengthen basic health care, basic health system, water and sanitation, improving agriculture, outputs, reforestation, and also preparedness and disaster management, like I was mentioning. And these were areas then that DPRK authorities have sought cooperation and also through the DPRK Red Cross. So I would say more long-term interventions rather than only acute humanitarian assistance. But that has also, of course, happened as well during various crises. And then I also wanted to mention that Sweden has had a quite significant role in DPRK, as we looked at some data, and between 2006 and 2023, Sweden was the sixth largest humanitarian donor to DPRK after the UN agencies and the UN SURF system, and following ROK and Switzerland. And that has meant that Swedish Red Cross has also had an engagement and support to the DPRK ever since. And in Sweden also, through the Swedish Red Cross, established a field hospital in 1950 in Korea and was the first embassy to establish itself in 1975. So we have supported the National Society consistently since then, but funding, of course, has dropped the last years, especially last 2-3 years, to pretty much zero level funding, except some own contributions that we have supported with our own funds. So I wanted to share a few pictures with you from my own visits to DPRK and some health clinics that I visited. So the National Society runs community-based resilience program, like I was mentioning, and really community-based health activities and interventions. So the pictures here show, I visited one clinic, for example, on the upper left side of the screen. This was the clinical room, and you see there's almost nothing there. and extremely cold as well. I believe this was in November, so it was freezing in this small clinic. Just a few medicines on the shelves, maybe some painkillers and choreo medicine, of course. A very cute, healthy baby, and that we could take a picture of. I've also seen children that were not as healthy looking, visiting different communities. And then just to show you, this is the way we have met people, meeting them in their houses and together with our colleagues when visiting different communities. And a very small lady that I'm standing next to. I'm not very tall, but I look extremely tall. So the idea is for the Red Cross to, like I said, to work in a more holistic approach. And of course, access to clean water, sanitation, food, and just basic health awareness is contributing to the health situation of an individual. And we know that vulnerability is linked to a combination of factors, including also weather events and the other aspects that I mentioned. The National Society also had a role in the COVID response of the country and in the anti-epidemic response mandate, and worked quite a lot on awareness raising, on hygiene and protection measures, promoting and spreading health messages, including first aid among community people by primarily through the Red Cross volunteers throughout the country. And this is the way to reach, of course, local people, and trying to influence a change of behavior as well. And all of this work is in line with the long-term plan of the DPRK Red Cross, their 2030 plan, which has an objective to assist people affected by crisis and disasters, and also to raise awareness on disaster risk management, but also to promote health and welfare of the people of the country. So under the health and well-being umbrella, what we know from last year is that there were two main activities that they also sought support for, which they are also doing today. We haven't had that many requests because our collaboration is very compromised and under stress, I would say. We can't really do much, but they've been asking for an update of the first aid manual, and this manual was then distributed throughout the country in the 9 provinces through the Red Cross staff and volunteers. And this manual is also being updated, or regularly, I think annually updated with the relevant ministries. And they are also distributed through the first aid posts that the National Society is running in 1,700 places across the country, which is staffed with Red Cross volunteers to help this. And then they're also asking for this year for procuring of first aid training kits as a request to national societies like the Swedish Society, for example, in their annual plan. So what do we know today? It's hard to know, like we are aware of, about the situation on the ground, and we understand that many people are still relying on aid, not the least food and medications. But we still haven't met our colleagues for more than 4 years, and the last IFRC head of delegation left Pyongyang in December 2020. So there's no feet on the ground with international presence, of course, except we do have national staff still with the IFRC. But they are in their situation control, in their messaging and sharing of information. And we can't really do much without being allowed to access back, and we are reliant, of course, on conversation that we have today, for example, and international networks, and secondary data that we try to put together the puzzle from. And we're also, like everyone else, challenged by the sanctions and the lacking banking system. And of course, the lack of access means lack of funding and data, like I mentioned, and communication with our colleagues in Pyongyang is still there, but it's more difficult, I would say, in the last well, maybe since COVID restrictions, but not the least the last close to 1 year, half year, 1 year. It's complicated and more challenging. And we also understand that the self-sufficiency agenda of the country is stronger than ever. However, as I still want to say that we're in it for the long run. IFRC is still present in Pyongyang with local staff and coordinates with the national society in the country. We are still in touch with our colleagues, and we're dedicated to be so. The Swedish ambassador is back in Pyongyang since September last year, and he has had some communication with some stakeholders in country, but there seemed to be no indication from what he is telling us for international humanitarian sector to return anytime soon, unfortunately. We try to speak to DPRK representations and representatives in various capitals and encourage for the DPRK Red Cross to return to international talks and engagements. Because we also see that we need them, we miss them, and their expertise and insights for the Red Crescent movement is very much missed. So that's what I wanted to share on the Red Cross side. We're staying put, but it's not easy.
Yeah. Well, thank you, Osa. This is really helpful. It's always, the big question is, what is happening in the humanitarian community? Who is getting allowed back in? We have had some notices or some information shared about North Korea asking, some humanitarian organizations, for instance, from Malaysia, to help. But when it comes to the international organizations like the IFRC, I wonder if you could talk a little bit more about what their response is, other than just no. Is it no, it's not time? Is it a non-response? Or is it more so, oh, no, we probably won't? Like, where does it fall on that scale?
So do you mean in terms of us asking to come back?
Right.
I would say it's not such a direct no communicated. It's just there's just no opening or no invitation to come back. They in a subtle way maybe communicate that we can manage on our own, kind of, but they still keep in touch. So they haven't stopped communicating with us, and they respond to emails, but it can take time. And we might not get the replies that we would like to. We would like to have maybe more concrete information about certain things. So just the structure of the national society or what's going on, but that's not shared with us. And I would say we're also in touch with the DPRK embassy here in Stockholm, and we expressed to them very clearly that we would like to return and pick up on or reestablish our partnership with the Red Cross in country. And I would say some time back, maybe 2 years back, they sounded a bit more optimistic that as soon as it's possible, you will get the visas and blah, blah, blah. But now they don't say too much in that, they're friendly, they nod, and they, so hard to answer.
Do you think the return of the Swedish ambassador to the DPRK in Pyongyang, do you think that is a good sign, or is it somewhat unrelated?
For us?
Yeah, for your work.
Yeah, it's a good question. I think it's unrelated. To be honest, I wish it wasn't, because also the Swedes are there also for the humanitarian agenda, so to speak, for Sweden. But I'm not sure. I hope it could bring some opportunity for us to engage somehow with the national society, and we're trying to build on that kind of opportunity, possible opening. But so far, not sure if it's gonna fast forward anything. They still seem to, this is my own understanding or analysis or of the situation. I think they still view us as a westernized international, maybe part of the bigger IFRC movement, which is also influenced by countries that they don't want to engage with. So yeah, and now we're part of NATO as well. So I'm not sure how that maybe has an influence. But the Swedes are there, so that's good. At least diplomats.
At least diplomats. It's
Yeah.
something. As you mentioned, everything when it comes to North Korea, it's complicated.
Yeah, it is, and it seems to be getting more and more complicated. It's always been complicated with patience, but yeah.
I wonder if I can ask you a somewhat tangential question, and you might not have an answer, you might not want to answer. But certainly, there's obviously drastic changes in US humanitarian policies through USAID and even through UN contributions, things like that. I wonder how or if that those shifts and those gaps now opening up may affect IFRC's and Red Cross's priorities in general. And if at what point does North Korea no longer rise to a level of priority?
Yeah, that's a good question. I can't speak for IFRC, but yeah, I think you have a point. We're also seeing in Sweden as well on the aid budgets that they are cut, and there's a heavy focus on Ukraine as well to support Ukraine. So I think DPRK is falling even further away from the political interest or arena, so to speak, in terms of funding. So yeah, it doesn't, from my perspective, it doesn't look very good. But of course, if we get access and there's a different opportunity to re-engage, I think also there would be an interest, at least from the Swedish side, somehow to find ways to collaborate, if possible.
Yeah.
I hope so.
I hope so too. It is one of those situations where the longer North Korea sort of has this standoff with the humanitarian community, the harder it is to maintain even the political will to keep doing. So the prospects for continuing work and growing the work.
Yeah.
Dwindle.
And it's really difficult for us to also explain the situation in country when we don't know exactly, because we're not there. Even though we have contacts and we try to understand. We don't have exact data, etc. So
yeah.
There
is one question in the comments from one of our participants, and certainly if there are other questions, please feel free to use the chat function to type them out. We're happy to take some questions from the audience. And if people have questions on the article itself, and especially on non-communicable diseases in North Korea, we can also pull in some of our other colleagues into the discussion, such as Ki and Hije. I'm warning you now, questions may come. But Osa, you mentioned that there are almost 360,000 volunteers. Assuming they are North Korean, what is their level of training, and are they paid anything, even though they're volunteers?
Yes, good question. So the level of training, I would say that they receive basic training on the Red Cross mandate and the mission in DPRK and the specific role that the Red Cross has in the country. Like we do in any context, we have an auxiliary role to the government, a certain responsibility. And then depending on what they're engaged in, they would learn some of the basic health, get some training on the basic health methods or activities that the Red Cross is running and how to promote this awareness raising sessions, etc. Or if it's around flood response, basic training on the activities that the Red Cross is involved in. If they're paid, I can't say. I don't know if they are paid or not. In some countries, in some places, they are paid a little bit for what they do. In other places, they're not. So, but I don't dare to answer that.
Great. We have one more question for you, Osa. Angie writes, while working on the ground in North Korea, what interesting or novel aspects of North Korea's public health system have you witnessed that are not well known to foreign audiences?
I think the Red Cross, from what I've seen, I mean, just from that perspective, they had an incredible important role in reaching out to people on very basic health awareness aspects, which is very important. And also that the structure, the public health system, I mean, the structure is there. You see health clinics, you see doctors and nurses, and the structure is there, but it's the issue, the problem, the main challenge is that it's relatively empty of materials, items, I mean, medicines and equipment, which of course is a major problem. So I haven't been there for a while now, but from what I know, the Red Cross is still has the same setup as what we know from before and do this really basic community-based work, which I think is hugely relevant also in DPRK to spread information and making people know about symptoms, etc., and hygiene practices and so forth.
Well, speaking of medicines, real quick, David, we'll get to you, but Ki, I wanted to pull you into the conversation real quick. Obviously the North Korea has had a big push on self-sufficiency, as Osa was saying. And we've seen this in the 20 by 10 policy and the rural development initiatives, trying to create that resiliency, even outside of Pyongyang. When we talk about non-communicable diseases, especially diabetes, insulin is a lifelong need, and insulin treatment is a long-term need. So there's obviously probably thought around what it would take to increase the ability to manufacture domestically in North Korea. And you mentioned, or in the presentation, it mentioned that there are, sanctions that hinder that process. I wonder, Ki, if you can tell us a little bit more about what some of those specific restrictions are, and has there been any efforts to try and alleviate them?
No, that's an excellent question, Jenny. A country like North Korea, which is a nuclear state, right, de facto, it's for them to be taking handouts while they're saying their nuclear state is just doesn't compute, right? And there's a shift clearly from humanitarian assistance or accepting humanitarian assistance to now more developmental assistance, which is a lot more palatable for the country. And it's not just a play on words, Jenny. It's actually the country is devoting resources to it. For instance, the insulin purchases, it's $1 million a year, and that's just one drug. We're aware of this data where North Koreans are now paying for certain drugs in these pharmacies. We came across some of that information. There's a market for that, right? So North Korea, I think, is more interested in removing some of the barriers so that they could become self-sufficient, consistent with the Juche philosophy. It was just in the news today, I think, or yesterday, that the North Koreans and the Russians have signed some sort of agreement to help develop additional manufacturing capabilities for pharmaceuticals. This is the kind of assistance they want. They even bought, I think, according to our calculation, 350 ventilators from China. These are not handouts. These are actual imports from outside. So I think moving forward, this is where we need to focus on. We intentionally did not call our webinar series humanitarian assistance for North Korea. We wanted to call it international engagement, right? So we should start thinking about the way that North Koreans are thinking about it: partnership, solidarity, building capacity, and then move away from this charity handout model.
And certainly the Russian North Korean cooperation even on medical provision probably butts up against some international sanctions, although the Russians, I think at this point in time, are less worried about that restriction.
I think sanctions, we can talk a whole other webinar about it. I think it's over.
David, why don't you, we'll let you ask the question.
Yeah, sure. So just to kind of, since you brought it up, that was the question I wanted to ask about is, not knowing enough about Russia, is there, as we've seen them try to replace, different aspects of Western aid with maybe Russian sourced benefits and so on. Do you know of, are there kind of humanitarian equivalents for?
David, am I frozen? He's frozen.
In Russia, or is there replace some of the more humanitarian? I don't know if.
David, you froze for a second. Could you just repeat the question itself?
Just are there Russian equivalent counterparts on our in terms of humanitarian organizations and efforts and so on, or like a Russian branch of the IFRC or Red Cross chapter? Are there things like that in Russia?
Osa, do you have any thoughts on this?
No, I don't. I don't think I can answer that. I don't know. But there's a Red Cross in Russia, yes, if that's, yeah. And I try to also discuss with them to see maybe if we could collaborate a bit. But it's of course very sensitive. It's difficult. So I'm not sure.
Is Russia a member to the WHO?
Oh yeah, they're a member.
And how is there opportunities through WHO for Russia to do more with North Korea?
It's probably unlikely that they'll go through a WHO mechanism. It's easier for many reasons for the Russians and North Koreans to work bilaterally.
Yeah.
Yeah.
Although with the US withdrawing from the WHO, it might be usable.
Nagi will actually work for WHO as a program officer. Maybe you can shed some light into that.
Nagi, do you want to? There we go.
There we go.
Can you repeat the question, please, sir?
Go ahead, Jenny.
I was gonna say, so really the idea of if Russia wants to do more on the humanitarian side or in development side with North Korea, especially in the health sector, would the WHO be a useful mechanism for that, or are there other potential mechanisms that they can use?
Well, for each country, they have to balance between the bilateral and through international organization. And I think that also to build on what my colleagues mentioned is that we have reached a situation, especially after COVID, that is they still are not deciding to go back to open the door for international organization. Mm. In addition to that, the changing geopolitical situation give them opportunity to deal directly and to, there is no, as you mentioned and Kim mentioned, there is no sanctions. So the bilateral relation now with Russia is more open. In the same time that if I were in place of DPRK, they, for many years, they expressed that they don't want humanitarian assistance anymore. Mm. They want developmental. It means that they have found out, after all these years of engagement with them, that giving medicine, giving food, giving this and that is not the essence. The problem is the knowledge.
Right.
So with Russia, I think with bilateral, they can get this more, especially when it comes, let me give an example, manufacture of vaccination or manufacture of medicine, which they have troubled even with the support of WHO and UNICEF, but always, for example, when we talk about medicine manufacture, you find the sanction committee say that it's biological weapon or vaccine or something like that. So they are fed up with this. They want really to go into this business. I hope that's clear.
Yes. Yeah, that's very helpful. I wonder, given all of that, Osa, if we can turn back to you for the final question, and that is, if you get back into the country, how do you anticipate the type of delivery to change, or the type of programs and delivery to change if you're allowed back?
It's for me?
No, for Osa.
Yeah, I think as Key was mentioned, was just said right now that they don't want to be viewed as a humanitarian context as such. So I think the programs or the ways of collaborating would possibly look a bit different if they're not faced with something acute, where we would step in if they asked for our support. So, but it would also be, yeah, it's so hard to predict, but long-term engagement, I think, and under conditions that they want to see areas of collaboration for long-term engagement, partnerships. I think we would maybe have to, refine and maybe not restart our ways of collaborating or partnership setup, but shifting for sure. But the problem is, or has been, and probably will be, is funding and streams and ways of accessing funds for that. So,
yeah, always the problem for most of the work that the people on this call do.
Yeah.
All right. Well, that is the end of our time. David, I'm going to hand it back over to you.
Yeah, hi, everybody. I'm David Hong, one of the members of the Korea Health Policy Project. You might have seen me on the previous webinars. Wanted to thank again Osa and Jenny for being our discussants and speakers today and moderating. Uri, who's not able to be with us, but she's busy studying as a third-year medical student at Georgetown. So we appreciate her efforts as well. Also, just wanted to take a moment to thank our organizing partners on this event. Of course, 38 North, the National Committee on North Korea, and Harvard's Program for Global Surgery and Social Change. We've also been working with the U.S. Institute of Peace, as well as the Council of Korean Americans, and of course, Children of Korea, our medical nonprofit side. We are looking forward towards our fourth session, which will be on April 22nd, again at 9 a.m. Eastern Daylight Time. That session is titled The New Era of Public Health Engagement with North Korea. We'll be having Marissa McPherson from NCNK moderating with Key Park as well, and our speaker at that time will be Sam Han, one of our own researchers, and Frank Alm from the U.S. Institute of Peace, who will be our primary discussant. We will be posting a link for YouTube for this recording of this video for others who are unable to make it today and others who want to review. And we really appreciate everyone's participation and the discussion, and look forward to seeing everyone on the fourth session. Thanks, everybody.